नमस्कार 90.4 सोआ रेडियो यही स्वतंत्र अध्याय आपण समस्त को स्वागत जनाऊँ मार्च आकृति। आज हूँ जून 19 तारिख। आज दिन को आम नेशनल पब्लिक हेल्थ डेंटिस्ट्री डे भाव में पालन कर तेज डेंटिस्ट्री कहले आपण मैंने बुझी सारी जे आम मुख स्वास्थ्य सहित जड़ित कि आम जो दांत पाटी माढ़ी किपर भाव में सुस्थ से नहीं आज आम आलोचना करवा। तेबे पब्लिक हेल्थ डेंटिस्ट्री ये डिपार्टमेंटर कौन सब भूमिका रही किपर भाव में पब्लिक जानवे जे निजर मुख स्वास्थ्य को किपर भाव में अधिक स्वास्थ्यकर करें भल जीवनटे बंची पारे से नहीं आज आम अतिथि मान पाखु जाना ए विषय आलोचना करने आज आम सहित सोआ यूनिवर्सिटी इंस्टीट्यूट ऑफ डेंटल साइंसेस पब्लिक हेल्थ डेंटिस्ट्री डिपार्टमेंट दुई जन डॉक्टर जोड़ी होती एचओडी एंड प्रोफेसर डॉक्टर स्वाति पट्टनायक एंड प्रोफेसर डॉक्टर धर्मश्री सत्यरूप। चलतु आज अतिथि मानक स्वागत जनावा पाखु आलोचनाटी शुणा पब्लिक हेल्थ डेंटिस्ट्री कौन सब रही भूमिका।
Namaste, I am Dr. Dharmashree.
Namaskar, I am Dr. Swati Patnaik. Today, I heartily thank Shiksha Anusandhan University for giving us the opportunity to talk about public health dentistry, smiles beyond the clinic. Everyone knows dentistry about being filling, straightening teeth, dealing with gum problems, but not everyone knows about public health dentistry. So let's get to know our department.
As Dr. Swati said, when everybody thinks of dentistry, they think about filling the cavities or getting a tooth extracted because of the pain. Public health dentistry does all of this, but at the population level. So, when somebody has a dental issue, especially pain, those people who have experienced it will know it is impossible for them to turn up for work, or even if they do turn up for work, they won't be able to concentrate. This also results in children missing school. So the awareness regarding oral health is limited in the population, and they think it is not important. But most of the general diseases are connected with oral health, as it has been supported with scientific evidence. So public health dentistry is the department that takes focus on to preventive and promotive oral health promotive strategies to ensure that these diseases do not occur at all, which is also called as the upstream approach. So for example, if I have to explain, we know that plaque is the cause of most common oral diseases, and if children are taught the correct technique of brushing at an early age, such as during school, we would be removing the chance of these oral diseases such as cavities or bleeding from the gums occurring later on in life. So this is where the important role of public health dentistry comes into the picture.
Very rightly said, Dr. Dharmashree. Public health dentistry strives to reach the population where they do not have access to healthcare or dental care. We try to reach underserved groups, especially like school children, elderly patients, patients with various disabilities, rural communities, low socioeconomic group people. So by going out and designing outreach programs, we try to reach them and solve the problem. So public health dentistry designs various outreach programs where we go to people who do not have access or limited access to healthcare. There we do screening where we can have early detection of diseases so that we can prevent them at an early stage. And we not only screen for dental diseases, we also gather data regarding their oral health status, regarding the problems that they are facing, or the barriers to accessibility of healthcare. So we reach the population who need us the most. Basic dental treatment. So the vans help us not only reach the people and give treatment, a certain basic treatment to them, it also helps us connect with them, collect information from them, and help design programs and plans which will help benefit them in the future. We also focus on creating awareness regarding oral health problems. Now, any dental problem or health problem doesn't start in just one day. It is there because of years of accumulated neglect, and unfortunately the neglect starts right from the birth. So we design oral health education programs or awareness programs from birth to old age. I'll give you a few examples. Now, many people think for infants and toddlers who do not have teeth or just are starting to have teeth, oral hygiene is not very important as they don't have teeth. But we are very wrong there, as gums and tongue also need to be cleaned because they harbor many harmful germs which can affect the children in the long run. As these infants and toddlers grow into school children, they need to be more independent. They need to be more aware of about their teeth. They need to know how to brush, what to use for brushing, what toothpaste to use, what is good for us, and especially what are the good foods that will help the teeth, because this will help them prevent dental diseases, especially decay. Now, when these children become young adults or teenagers, they face a different set of problems. Progressing decay, crooked teeth which affects their smile, which affects their personality, their self-esteem, and also unfortunately the rising problem of tobacco and vaping, which is sadly perceived as cool. For the middle age group, a lot of people are already deep into the dental problem, but what kind of problems do they face? They have problems such as increased gum diseases along with previous decay if they had any. They have stress-induced problems, work-related stress, home-related stress. So I would advise a simple routine checkup which will help them tackle the problem at the bud level. Now, as this population grows into the senior group, the problem even becomes bigger. How does it become bigger? Because the gum problems, the decay transform into the severity increases and there is loss of teeth, leading to eating problems, difficulty in chewing. They have a new set of decay problems in the root of the tooth, and there may be and even certain patients may also present with a problem of oral cancer or related lesions. So it is our job to sensitize them, to make them aware about all these problems.
Another important aspect of public health dentistry is to ensure that there is equitable access to oral health care. In the rural areas and in the tribal areas, there is limited access to health care, especially oral health care, because of the financial constraints. And in the urban regions, there is limited awareness regarding oral health. So this specialty, as Dr. Swati said, through its outreach activities and the mobile dental unit, strives to make sure that this access, the barriers to the access are removed. And so as Dr. Swati said, this specialty tries to focus on mitigating these barriers to oral health access through outreach programs, mobile dental van, and making sure that the treatment required by these communities are available to them at a cost that is affordable to them.
Public health dentistry not only reaches to the unreached population but also contributes significantly to research by conducting various epidemiological studies, field surveys, and by doing so we generate vital data which is essential for policymakers designing health programs, preventive strategies, and resource allocation. Public health personnel work with various government health agencies, non-profit organizations, universities, and global organizations like WHO, UNICEF, and ICMR. The impact that we create is massive by reaching to communities and focusing on the social good rather than the financial gain. It's a career filled with purpose, empathy, and leadership by producing not only good clinicians but also socially responsible individuals.
Public health dentistry also aligns with the oral health global activities given by the WHO and the FDI. WHO for a long time has been emphasizing on incorporation of basic oral health services under universal health coverage, and the FDI, which is the World Dental Federation, advocates the use of community-driven preventive approaches to reach the population, and our specialty keeps this, aligns with this and works towards it.
Very rightly said, Dr. Dharmashree. Now, a strong department of public health dentistry not only focuses on the institute's academic growth but also on research and social responsibilities or the social mission. It connects the university to the population by encouraging the students to go for rural postings, by health activities, conducting treatment and awareness camps. We also integrate with various other departments like the public health department, various medical departments, psychology department, nursing department to enable mega health camps so that we can tackle the larger health problem.
So every institution has a social responsibility, and this is similar to the CSRs by big corporations or the MNCs. So it is the social accountability of every health institution to make sure first to create awareness among the population and then to ensure all their services provided are affordable and accessible to all groups. So therefore, in conclusion, I would like to say that the Department of Public Health Dentistry goes way beyond the confines of a classroom or a clinic, and it is more community focused, research driven and socially responsive. It aims to improve oral health literacy, promote equitable access, inform evidence based policies, support global health initiatives, and also nurture socially responsible professionals. As healthcare setup is increasingly shifting towards a community-driven preventive approach, the role of public health dentistry becomes even more important both for the society and the institution.
So, how do we reach the unreached population? This is done via mobile dental vans or clinic on wheels, which are very crucial for us. These vans are equipped with dental chairs and basic dental instruments to give basic dental care to the population. They not only help us in delivering and rendering treatment to the population, but also help us in collecting data, understanding the needs and barrier to healthcare access.
So using this mobile unit, we have gone up to 120 kilometers where we have provided the basic dental treatment at the place of the camp, and then for the other complicated treatment that cannot be done at the location, we refer them to the Department of Public Health Dentistry, where all the treatments that are necessary are done at an affordable cost. If in case it requires more complicated treatment that requires a specialist intervention, only then the patient is referred to the other departments. Apart from this, on special days, we have awareness drives in the form of street plays that convey important oral health messages in a very simple and attractive form using attractive education materials such as posters or pamphlets, and we usually do this to celebrate important days such as the World Oral Health Day, the World No Tobacco Day, etc.
Now, dental health problems or any health problem for that matter doesn't start in one day. It takes years of accumulated neglect to reach a certain stage, and unfortunately the neglect starts at birth. So, we as a department design oral health awareness education material for each age group and help them understand their needs and how to tackle their problems. Now, let's discuss about what do we educate them about and how do we educate them about. For example, for infants and toddlers, a baby who is just born, everybody thinks that, okay, why do we need to take care of their oral health? They don't have any teeth. But the truth is, we need to clean their gums and tongues as well, because it harbors a lot of harmful germs which will affect the baby when the teeth start coming out. So to ensure that the teeth grow in a good and healthy environment, parents need to understand the importance of cleaning gums and tongue. Now, babies also face a problem of teething. They are not able to tell the problem. They start crying and they are very desperate for help, and parents are obviously anxious about it. But we also help parents understand the teething problems and how to tackle them. Now, as these children become school children, the problem and needs change. School children already have got a complete set of teeth, so they need to take care of that. Many people think that these are milk teeth. These will go off. We will have a new set of teeth. But we also need to take care of our milk teeth, because if the milk teeth go bad, it will affect the permanent teeth also later on. So to help children take care of their teeth, we help them understand about the right way to brush, what brush to use. Do you know children have different brushes available for them? Do you know children have different toothpastes available for them? So we educate them, the parents and also the school authorities, regarding the importance of brushing, the right way of brushing, the using of the right toothpaste. Not just toothpaste and brush, we also talk about healthy and right eating. What we eat matters a lot, and it affects the oral health and the overall health. So educating children about the right way to eat, the right foods to eat, encouraging parents to develop nutrition and nutrition based meals which do not affect the oral health a lot is a part of what we do. Now, as these children become teenagers and older adults and young adults, their problems slightly change. How? Now, they may start developing decay or cavities in the teeth which needed to be treated. But also the fact, also one thing that we can prevent this decay from happening. Public Health Dentistry Department also conducts many pit and fissure sealant application drives, fluoride application drives, which are essential and crucial to stop the progress of decay or stop the start of decay at a very early stage. But for those children who have already developed decay, we encourage them to visit the dentist and get it treated. We make the parents understand the importance of keeping the teeth healthy and clean. Young adults also face the problem of crooked teeth, which affects the way they eat, the way they talk, their self-esteem and their whole personality. They may be very conscious and shy because they feel that the teeth are not good. So we encourage them to visit Institute of Dental Sciences, where there is a department specific to treat their problems. Another increasing sad burden, I would say rather, is the use of tobacco and vaping, which is quite popular among the teenagers nowadays. It may look very cool, but unfortunately it affects oral and general health a lot. It also contributes significantly to early rise in oral cancer burden and related problems. These are regarding children. Now, when we talk about the middle age group already may have certain dental problems. Apart from that, they see a new set of problems like increased gum diseases, stress-induced gum problems and stress-induced oral problems. Hence, we advise them to take some time out and visit the dentist or our college for a routine dental checkup, where they can tackle the problem at the bud level. Now, as this population grows into the senior population, the problem unfortunately becomes more. Along with decay and increased gum problems, they also may face problems like loss of teeth, which obviously affects the way they eat, what they eat. And it again, because the food habits are changing, their nutrition is also affected. Apart from loss of teeth, oral cancer is a rising problem in the senior population. Hence, it is very important for them to get themselves screened every 6 months to 1 year, so that we can detect the problems at an early level and help them tackle it. Apart from these populations, there are certain vulnerable populations like pregnant ladies. Now, pregnant ladies have faced their own dental problems because of change in hormones. Many people would have heard about pregnancy-induced diabetes, but not many are aware that there is something called as pregnancy-induced gingivitis, where pregnant ladies can experience a sudden bleeding gums, a change in their taste, a bad breath and everything. But sadly, they don't go to the doctor because they are scared or unaware that this is a very treatable problem. Yes, I agree that in pregnancy we do not advise all kinds of treatment, but certain basic oral hygiene care are provided to pregnant ladies which will help them maintain a good oral health. Now, disabled population, a very less talked about population in terms of oral health. Disability due to any developmental disorder, any neural disorder, or disability because of any physical issue can prevent the individuals from taking good care of their oral health because of difficulty in holding a brush or because of not understanding what to do at the right time. So we try to educate the individuals as well as their caregivers regarding the importance of taking good oral health care for them, so that in the long run they do not face a lot of oral health issues, as dealing with the problems at a later stage becomes difficult because of the lack of communication between the population and the doctor. Apart from that, we also try to reach the underprivileged children, underprivileged population, and give them basic oral health care. When we go out in mobile dental vans, we render the treatment free, but whatever we cannot, we try to deal it in our department at a very affordable and low cost.
Another aspect of public health dentistry is to ensure that all oral health services have equitable access. There are rural regions, tribal regions that have limited access to oral health, and even if the oral health care is available, they are unable to afford it due to financial constraints. Whereas urban areas come up with their own set of problems such as limited oral health awareness. So public health dentistry also is trying to bridge this gap. We have a sub-center in the rural area and also another one in the urban settings where basic health services are available along with oral health care, so that we are able to bridge this gap and make oral health care affordable to all. Another aspect of public health dentistry is to ensure that oral health care has equitable access. There are regions in the rural areas or the tribal areas where the access is limited, or when it is available is not affordable due to their financial constraints. And in the urban areas comes a different set of problems such as limited oral awareness. So public health dentistry has sub-centers in both the rural and the urban regions where apart from oral health care, basic healthcare services are available, and this ensures that the services are available to all population irrespective of their social standing at a cost that is affordable to all.
I hope today's talk gave you an idea about what public health dentistry does. Please do feel free to reach out to us in case of any queries or any doubts. We are always available at Department of Public Health Dentistry, Institute of Dental Sciences, Shiksha Anusandhan University.
तेज श्रोता बंधु आज आम आलोचना करुले पब्लिक हेल्थ डेंटिस्ट्री डिपार्टमेंट विषय रे कौन रही तार भूमिका से विषय जानिले अतिथि मान पाखु जदि कौन प्रकार लक्षण बा सिम्पटम्स आपण मैंने निज मुख स्वास्थ्य को नहीं देखुंट निजर हो आखपाखे कहार भी देखुंट तेज से सचेतन करातु से बुझातु निहाती भाव में जाकि हस्पिटाल डाक्तर परामर्श नियंतु जदि निजे सुस्थ रे निहाती भाव में गोटे सुस्थ जीवनटे बंची पारे ता सहित गोटे सुस्थ परिवेशटे आम बन पार। आज तो समय हो गला मत विदाय दिंतु पुणी थे आपण नहीं आसबि मुखर स्वास्थ्य को नहीं आउ एक नुआ अध्यायटे। टिल देन स्टे ट्यून टू 90.4 SOA रेडियो एंड कीप स्माइलिंग।
आपण सुनुछंती 90.4 SOA रेडियो।